Nova Scotia reported record high case numbers over the weekend. Both Saturday and Sunday saw well over 100 new cases each day. So far, the province's strongest line of defense against virus spread has been widespread accessible testing. But now, demand for those tests and the reassurance they provide appears to be outpacing capacity. Health officials on Friday reported a serious backlog of 45,000 swabs. Brett Ruskin is live in Halifax, and he has more on that story. Brett, we have seen the long lineups outside testing centres. Now officials are racing to get those results out before more infections spread. How are they going to handle the backlog?
Well, yeah, this isn't really a problem of anyone doing anything wrong. It's more so a problem of people doing things right, of trying to get their tests. And so we have seen, as you said, those long lineups to get tests done. And it all kind of culminated, or perhaps the straw that broke the camel's back, was one day last week when there were 22,000 tests that came into the testing center. And that really was one of the certainly the largest day of tests. And now we have that 45,000 test backlog. That's what we heard from Premier Ian Rankin, as well as Chief Medical Health Officer Robert Strang on Friday. And now people are working towards relieving that backlog. And one way that they plan on doing it is if people were part of or may have been at a possible exposure site and they're not showing any symptoms, instead of booking a test at one of the testing centers, they are being asked to go to the rapid testing centers. And those rapid testing centers have been championed by Dr. Lisa Barrett. We've spoken with her a number of times. Here's what she has to say about that rapid testing that's been happening all throughout this pandemic.
We've been testing almost between 3 and 5% of the Halifax regional municipality area several days in a row, each day. What I call mopping up in the background is getting a sense of how much virus is around in our communities.
And so just to give you an example of how common it is, I got my rapid test over the past weekend as well. And so it is a frequent thing that Nova Scotians do to go and get their rapid testing done. And so we will find out more information about the backlog at a news conference that's scheduled for late this afternoon here in Halifax. Heather.
So case numbers going up, Brett. We're also hearing about hospitalizations and ICU admissions on the rise in the province. What's the latest there?
Well, sure. Right now we have 6 cases in ICU. That's compared to the first wave when we saw 8 people intubated over the entirety of the wave. And so that is something that is perhaps more serious of a situation. And in fact, that we see 6 all at once right now. There is an expansion plan. There is still space in the ICU should things deteriorate further. And so that's the situation in the ICU. As for, everyday citizens, what can we do now? Considering that we don't really know the precise situation, like where we are at with this backlog of cases. Some might be positive, some might be negative. We don't necessarily know that daily case count is 100% accurate. So what can we do? Well, kind of the same thing we've been doing for the last week or so. Remaining in lockdown, limiting our movements, limiting our interactions with other people. That same strategy is going to work to bring cases down regardless of how high they are.